In this video clip, we're going to look at some of the examination basics for a patient who might be demonstrating to us limited or restricted finger extension. So with our patient's hands folded together in almost a fist-like position, we have the patient attempt to straighten fingers 2 through 5, both sides. And we actively analyze the active motion, and we can see in this case that the second finger on the left does not fully straighten. First question, is it not straightening at this joint because it's painful? So we gently deliver an overpressure test into finger extension. If that hurt our patient, we clarify where it hurt them, and then we have a better sense that it might be perhaps some type of joint capsular irritation or subchondral bony discomfort secondary to osteoarthrosis. Next, let's examine the infield. In a finger that's not extending fully, just simply study the passive movement with repetitive, small motions in the direction of finger extension. If the infield comes early and feels firm, likely the palmar portion of this finger capsule has shortened, and that's not allowing the patient to extend their finger fully. There's one other scenario here. The long finger flexors could also be limiting active finger extension. So let's simply do a little bit of muscle length testing by changing the position of other joints where these long finger flexors cross. So we'll try to extend the finger fully, and then we'll add wrist extension. And then we'll try to extend the finger again. And then we'll add forearm supination, wrist extension, and attempt to extend the finger again. And then lastly, we'll add elbow extension, forearm supination, wrist extension, and then try to extend the finger again. During this process of muscle length testing for the long finger flexors, if the end field becomes progressively more elastic and you continue to lose more and more passive finger extension, you know that there's an element of muscle shortening affecting this patient's ability to fully extend their finger joint.